I want to be a safe place and a beacon for women to say, I am so exhausted of doing all the things, and how can I get better in my sleep? Because I recognize it as a foundation, and I truly recognize that I have worth. And walking around like a zombie, connecting with my loved ones like a zombie is not the best me.
It is an absolute pleasure to introduce the pure delight that is Dr. Angela Capozzi. Angie is such a beautiful combination of grounded and driven, mixed with passion and presence. She takes all of this to serve women struggling with chronic sleep issues as well as insomnia without medications or gadgets. She has her Psy.D in clinical psychology and has a public health focus with a mission to improve access to evidence based interventions to more people. She's going to walk us through several tips and tricks on improving our sleep, so make sure to stick around to the end of the video. Without further ado, Dr. Capozzi.
Thank you, Rebecca. Thank you for having me, first and foremost, and providing an opportunity and a platform to
Mm,
connect with you, connect with other women, to kind of spread the word and spread the mission. So thank you for having me.
absolutely. Absolutely. It's
Yeah,
such a pleasure
thank
to
you.
have you. So we all end up kind of, and as a therapist, you know this, you kind of end up
Yeah,
in the area of focus that you may have struggled with in the past, oftentimes.
sure.
And could you just give us a little bit of background and your own story on how you became so interested in sleep
Yeah,
or lack of sleep, rather?
right? Sure, sure. So that's such a fair question. For me, I think it's kind of twofold. So I received my doctorate about 22 years ago in clinical psychology with a specialty in health psychology and really a focus in primary care. So after grad school, I then got my residency in primary care psychology, and ever since, I've been working in a really fast-paced primary care culture. So that's part of my story is that's what I'm used to, and that's what I love, and honestly, it can really lead to burnout quickly. So in that primary care environment, I was the sole non prescribing provider to be of service to potentially over 30,000 patients, non prescribing for insomnia and chronic sleep issues. So I got educated really fast with evidence based interventions to be of service and honestly to be of service quickly. Now, when I say
Mm,
quickly, I'm not about the quick fix, but the truth is I didn't have a lot of time. The patients didn't have a lot of time. The primary care providers didn't have a lot of time for me to be an addendum with the interventions.
mm,
So I wasn't always as fast and good as I am now, but with enough time and specifically focusing in primary care and health psychology for over 15 years, it's kind of sink or swim, and you get good
mm,
fast. So honestly, because of that situation, I had to get good fast or just the referrals would stop. And it became a gift and a passion of mine. So I love the sleep referrals. I found that it happened to be one of my gifts that I was very good at deciphering in a short amount of time, is this a chronic sleep issue that I can be helpful with? And that's something that you'll also, and hopefully your audience too, will get to know about me. There's a lot of different sleep disorders, right? So there's
mhm,
REM behavior sleep disorder, some of the more common ones. There's sleep apnea, there's clinical insomnia. There's all these different sleep disorders. My gift, my intervention, my skill set lies in particularly clinical insomnia. So I'm always going to be very transparent with someone when I have a sense and I screen out for other sleep disorders to let them know, hey, it looks like sleep apnea is going on either solely or comorbidly with clinical insomnia because I would want nothing less, right? So
mhm,
I'm not going to take somebody into my program if while I'm connecting and screening them, it looks just, pure sleep apnea. They wouldn't be a good fit. And so I'm not going to just leave them, but I'm going to share with them why I think potentially, hypothetically, the sleep apnea is going on, and then refer them out to sleep medicine or help them get the next steps. However, the prevalence of clinical primary insomnia, I think the stats alone in 2022 are over 70 million Americans,
Mm.
and it hits women harder, unfortunately. And so,
Mm.
even though I am open to working with men, and I've certainly worked with a lot of men, my heart and my passion is in serving women because we're hit harder with it. So, to answer your question, access and experience is a lot of my story, but then also myself, like I turned 51 at the end of this month. I know what it's like to be a female in her early 50s, and I've definitely had my challenges with good sleep.
Mm.
So I walk my talk, I use my interventions on myself, and I know how it can wreak havoc in your life, in your relationships, in your health, in your communication, in your career. I really see it as a foundational piece that without good, solid sleep, we don't have a lot. We can't
Mm.
access the best of ourselves and we can't access that thriving. I enjoyed listening to your podcast thus far. And when I was hearing the one on imagination, we don't even have the luxury of tuning in to imagination and creativity and thriving if we're not sleeping.
Mhm.
So I really see it as a public health focus and have a very, very strong mission to be of service, especially to women. It tends to be women in that 40 to 64-year-old bracket simply
Mhm.
because they're suffering the most, and to help them understand there's a way to heal holistically from your chronic sleep issues without the reliance on medication and without the reliance on gadgets. You don't need them.
Mhm. Hmm.
Yeah.
I know that it's one of the first questions, at least definitely during that first session with a client, is how's your sleep? Because
Yes. Yes.
they can't, it really determines that sometimes that's the very first thing that we need to work on because they're not able to process any information and, well, in
Exactly.
a way, yeah, in a way that's sustainable or effective
Yes.
even.
Yes.
Yeah,
Yeah.
it's foundational, absolutely.
It is. It
Foundational.
is.
So what is it about, is it the hormones in the women that make it, or in us women that make it more difficult that we get hit with the insomnia? Is that what's
So
going on?
yeah, that definitely plays a part. It's not necessarily just that, right? Because if it was, I'm not an MD, right? I don't have my
Hmm.
doctorate. I don't have my medical doctorate degree. So it is the hormones, but it's not just that. But it is what complicates the picture, right? So when we're heading into perimenopausal menopause, we lose that estrogen. We
Hmm.
lose the progesterone. Either, we don't have it at all or it significantly decreases. And that really, really can negatively affect our sleep cycles. And that's part of the picture, right? So it's a complicating factor, but it's multifactorial. So this is kind of where I get a little bit on my soapbox a little bit, and so steer me in what you find interesting is that, like anything, there's not a quick answer. So the hormones complicate it, and then just kind of stepping back and taking a breath of what most women in our society are asked to do, tasked to do, where they find their worth. And I'm absolutely guilty of it, working on it, work in progress, of finding, I think even subconsciously for a lot of us, finding our worth in the hustle alone, right? So
Hmm.
seeing ourselves conceptually as just caretakers, although that's a beautiful role to have, right? But a lot of times we can define ourselves as women in caretakers alone, whether that's with kiddos, grandparents, loved ones. So I think that we have been socialized into this grind culture and hustle culture of finding our worth outside of ourselves and in the hustle. And it can be really difficult to deprogram that. It can be really challenging to awaken from that slumber, from that dream, and then have the braveness to say, okay, I get it. I get how that plays a role, and I'm willing to stay awake, wide open, and deprogram. It takes courage, it takes bravery, because that is not what's praised in our society. I believe, in our society, it's go, go, go. It's the faster you can multitask, the better you are. And women are oftentimes expected to do all the things, and it's so exhausting.
Mm.
It's so exhausting. So
Yep.
I that's what also holds dear to my heart, is also empowering women in, honestly, a fun, authentic, transparent way of mm, allowing them, and maybe even sometimes helping them see their worth in and of themselves, right? You don't have to hustle faster or work harder for your worth. You're worth it right now. You're worth
Hmm.
it right now. You deserve a stronger base of health right now. You deserve a solid night's sleep despite the hormone disruption right now. And there's a way to do that holistically where you don't have to rely on medication, honestly, like 99% of the time. You don't have to rely on the next gadget that has been, promoted. You just don't. However, in this kind of message, is that it's really hard to decipher like true, credible programs, people, let's be honest, because there's a lot of crap out there. So that's, I think, what can be challenging, understandably, about a coaching program like mine that I'm offering. So offering holistic health coaching program focused to women, helping them recognize you don't need to rely on the meds. You don't need to rely on the gadgets. There are things that I can teach you and empower you in learning your own sleep cycle and helping yourself now as well as different stages in your life. So it's a real sustainable solution. And I think women deserve nothing less than that.
Hmm. I love that.
Yeah.
I love that. I love that
Yeah.
you're opening up the conversation to give women permission to do things differently, to change the narrative around. Like as you were talking, I was thinking,
Yes.
"Oh my gosh,
Yes.
I don't have time to sleep." Like how much is of that is
Right.
embedded into that subconscious programming of go, 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 go.
Yes.
And
That's what I'm talking
there's
about.
oh, yep, yep, yep. I would love to hear some strategies maybe that you're able to bring to the table to help people navigate their relationship, especially women navigate their relationship with sleep.
Sure, sure. So I'm eclectic, and so my approach is eclectic.
Hmm.
When you've been studying it for this many years and just being with people and being of service and awake, it's really hard not to kind of grab your favorite things, right,
Hmm.
from different theories. So very eclectic and behaviorally based, cognitively based. And having said that, with this approach, I also, because I have a love for it and a high respect, somatic based.
Mm.
So I bring in behavioral interventions, I bring in cognitive interventions, I bring in somatic interventions because they have their place. And it's
Hmm.
definitely not a one size fits all. Nothing is, right? So it starts, I think, in the beginning with my free evaluation call because consultation because I really want to set somebody up for success. And I'm doing this to be of service and to really increase that access, right? And like we were saying before, if it sounds like, and I've just been doing this a while, it's pretty easy to pick up. If it sounds like, wow, this is primarily a sleep
Hmm.
apnea, unmanaged, doesn't really feel like a comorbid clinical insomnia, I'm going to tell you that because my program's not going to be a good fit for that and it's not going to be of service. So I'm going to be the first one to say, hey, I think this is what's going on. I would encourage you to take XYZ steps. Whereas if it feels like somebody's going to be a good fit, we're going to set from the get go really concrete goals and strategies. Because here's another fun thing,
Hmm.
and I don't think I'm going to regret it. In my rebranding, I guarantee results because I am so confident that what I have to offer, if I screen you into my program, I absolutely guarantee results on the goals that we set. So if
Hmm.
you are a good fit for my program, we're going to set out a plan and a strategy. We're going to have concrete goals as to this is what you're working towards. Very individualized, concrete goals. And I absolutely guarantee them. So
Wow.
it is a 6 week module where people have access for 4 months. And my guarantee is you will get results way before then. However, if you don't, I will continue to work with them until you get the results that you and I said from the get go from that consultation call. So I say that not to be egotistical. I am confident in what I do. I say that to try to help allow people to take a breath and go, okay, she's credible. She knows what she's doing, and she wouldn't offer this unless she feels like she can deliver. And that's absolutely true. And I recognize that being on the other end, and if someone hasn't met me before and connected with me and interacted with me, they don't know me. So something
Hmm.
like that guarantee can be super helpful and help people just relax into the program and then get the good help they need.
Oh, that's neat. So it's a win-win, really.
Yeah, it's
Yeah.
a win-win. And more women need this. So that's what's exciting, right? Like I could talk for
Yeah.
hours on so many of the different tangents on access and how women are oftentimes in our society asked to do all the things. And I think we need more things in our society saying you are perfect the way you are right now, and what would you like to improve for your heart, for your soul, for your well-being so that you can thrive?
Hmm.
Yeah?
Hmm.
Yeah.
Hmm. So just for the listeners, can you define a little bit what insomnia really is and how
Yeah.
that might look different, maybe in from person to person, or like what is insomnia and then what does it look like?
Yeah, so great question. So I'm really targeting those people, and honestly, it's probably the people that are going to be most interested in my program with the chronic sleep difficulties because I really believe that we are smart and resourceful humans and beings. And if it was just an episode of a stressful event or perhaps a loss, most of us are pretty resourceful and we're probably not going to need professional help. Yeah. And we're
Hmm.
not going to need a coach that focuses on chronic sleep issues. And if that's all that someone's dealing with, lucky you. That's great. And that move on and thrive, and that's wonderful. So I'm really targeting that chronicity, that this is not just an episode. This is you know, what do I mean by that? 3 months or longer chronic sleep difficulty that negatively affects day to day functioning. So it's that functioning piece,
Hmm.
right? So it's the time piece, at least 3 months or longer. It's that functioning piece. So we can see it show up in our work. We can't focus as well. We can't concentrate. We're not on our A game. We see it in our relationships, our ability to communicate, our connections with our partners and kiddos and friends and family. It's not there because we're exhausted. So it's
Hmm.
that time piece and that functioning piece. And that's where my program is of real service is to those people who are really struggling chronically with their sleep difficulty. And it could be for a whole host of reasons, right? As to
Hmm.
why people are struggling. It could be years of bad habits, it could be years of bad habits and that stressful scenario, move, lost, what have you. And then hello hormones for women, coming on, and hello type A women, which I'm no stranger to, that, have totally bought into and are working on deprogramming the go, 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 the multitasking, the doing it all. That's why it's so easy for me to speak to that because I'm going to be very transparent and authentic that until kind of waking up to that, I totally bought into that. So there's no judgment. There's no judgment. I want to be a safe place and a beacon for women to say, I am so exhausted of doing all the things, and how can I get better in my sleep because I recognize it as a foundation and I truly recognize that I have worth. And walking around like a zombie, connecting with my loved ones like a zombie is not the best me. The
Yep.
truth is, it doesn't take long. That's the thing. I'm not about the quick fix, but when you get someone who is truly at their pain point, and is ready to do something about it and does not buy into here's a pill for this or here's a gadget for this and says, help me, focused, it just doesn't take long. And that's exciting. So to hear somebody say, wow, like I've got this. I am waking up rested. I'm kicking ass in my day-to-day functioning in my relationships, if they work in their work, just really showing up to life their best selves. There is no
Hmm.
greater gift. That is so exciting to hear.
Oh, that's so
Yeah.
rewarding, I bet.
Yeah. Yeah, it's fun. That's the thing too. I find that with this, particularly with the sleep work, like I get energy from it. It's so much fun.
Mm.
And I also feel of service. So I have truly been lucky and blessed and to study a lot. So I'm also a nerd at heart, and I don't mind admitting that. So I've been so lucky to study for so long and have really good mentors. And I do feel a calling, a service to give back. You know what I mean? I
Hmm.
don't think that these interventions should just be when you see your oftentimes doctor, primary care provider, internist, and what? They happen to have a behavioral health specialist with them. Good luck with that. Not many
Right.
do. Not many do have that integrated care.
Hmm.
So is that fair that only a small section of the society that their primary care doc is set up as that gets that access? I don't think so.
Yeah.
So that's also part of the fun of trying to reach more people, reach more women, because we all deserve that, not
Hmm.
just ones who potentially have access. And that's going to be limited. That's going to be limited for people. And it doesn't have to be. That's the thing. It doesn't have to be. And in my opinion, it shouldn't be.
Hmm. So one of the things that I keep hearing from clients is around
Yeah.
sleep is
Yeah.
my brain just won't shut off. It's just keeps
Yes.
going and going and going and going. And do you have any suggestions around that? How they
I
can?
do.
Okay. Yes. Yes.
I do. So I appreciate you bringing in like just a really applied example. So it can be very difficult to just turn off at night, right?
Hmm.
Especially our minds and our thoughts in our head. And so one of the biggest things that people can do, biggest mistakes rather, that sabotages their sleep is there's many things, but I'm going to focus on what you asked me. So they're lying in bed and their mind is going a million miles an hour and they're thinking of all the things, right? And it can be anything. It can be a common stressor, a worry, a to-do list, rewriting something that they did during the day that they wish they would have done differently. It doesn't matter. Their brain is on. And so
Hmm.
here's a rule of thumb to do with that. If you feel that and I can guide them kind of looking at the clock, not looking at the clock. So let's say you can't look at the clock because that just makes you nervous and ramps up anxiety, which happens for most of us. So back to that scenario, you're in bed, your mind's going so quick, you can't turn off your thoughts. It's very real. And don't look at that clock because that makes most of us more anxious that we're, not succeeding and sleeping. And if you recognize that you're that cognitively engaged, get out of bed. The worst thing to do is to stay in bed and monkey mind, right? Busy
Hmm.
mind. The reason is all behavioral. When we do that, our mind and our body gets the message that bed is a place for awakeness. And indeed, it's not. We want to program our brain to recognize that wonderful, luxurious bed is for sleep. For I say with a little bit of humor, it's for sleep and sex only. So literally, if you're not having sex and you're not sleeping, you have no business in bed. So we're not talking about sex, but when you're not having sex and if you're not sleeping, you got to get out of bed because you want the bed to be a strong stimulus cue for sleep. And
Hmm.
when we lay there awake, struggling, eyes open or closed, it doesn't matter. It decreases the bed being that cue for sleep. So, getting out of bed when we're recognizing that we're just that cognitively on, getting out of bed and doing low stimulating activities. So what might this look like? It's going to be very individualized. It's going to look different for different people. But basically, what I'm asking people to do is no electronics, right? So no computer, no phone, no Kindle, none of that, because blue light. All of those devices emit blue light, and that's very stimulating to our central nervous system, and it tells our brain we got to be on. She wants us on, ready to tackle the world. That's the last thing that you want. So staying away from the electronics. Lights low, kind of mood low, because the idea is get out of bed, piddle piddle. It's not sophisticated. I do have very concrete examples for people, and we can talk more about that. But basically, you're kind of piddle piddling, non electronic, until you begin to feel sleepy again, i.e., eyelids heavy, head boppy, sleepy, reading your body. Not getting nervous about the time, trusting yourself and leaning in that your body has all the answers because it does. And then when you get sleepy, with the idea of going back to bed. So for a lot of people, that low stimulating activity could be loving on a pet, going to a couch or chair, reading a book, flipping through a magazine, perhaps listening to some music that relaxes your nervous system and soothes you. Things like that. So low stimulating activities. And then with the idea that you're working, so to speak, to get sleepy again, to go back to bed. And so you are behaviorally training yourself. And I like to say this too, just like we do our dogs and our kids. It's behavioral training for ourselves of when we are to be in bed and when not to be. But that is the solution for when you lie down. And let's say you thought it was a good time, right? You were sleepy, not just tired. You thought you were reading your body, you lie down, and then your mind just gets going. It's really, really normal. Part of that is a conditioned insomnia, and part of the program that I offer helps you behaviorally recognize that and change that behavior.
Mm.
So the good news is very, very doable. That's a behavioral change of how to break that bad habit. And that's all it is. It's just a bad habit. And a lot of people just never knew better. They didn't know to do anything else. They are thinking, I just need to stay in bed, right? So it's kind of parallels to what we were talking about before. Just work harder, just do more, right? I just need to stay in bed and go to sleep and do have my body do what it's supposed to do. And that's not what you're supposed to do. We need to behaviorally break that habit to really get that cue strong for sleep and behaviorally train your mind and your body. Bed equals sleep. Yeah, so that's a great question. That's a great
Yeah.
question. I appreciate you just laying it out there and going, hey, so what would you do
What
here?
about this?
That's
So
right. That's right. So good.
is there so the night I'm a night owl, or the people that stay up really late, or the
Yes.
people that really
Yeah.
are, they go to bed a lot earlier.
Yeah.
Is there a difference between those two? Or, like, I know when I was going to school, and I know my mom did this as well, is sleeping for 3 or 4 hours, and then up for 4 or 5 hours, and then sleeping for another 4 hours. Is that mess with your sleep cycles? Can that work? Does this
So
work?
I wouldn't recommend chunks like that
Mm,
unless you absolutely have to, right? So some of the most difficult scenarios that I've come across is working with shift workers. Whew, that's
yep,
hard.
yep,
It
yep,
is
yep.
so hard, yet it's so real. So I'm not going to turn somebody away for that. I'm going to be very real that it's going to be tough, especially how long they've been in that shift schedule and cycle. But I'm
Mm,
still going to be of service, and we're going to tweak and optimize as much as possible. But going back to your question, a couple of things come to mind. So, whether one's a morning, I love this question too, I appreciate it. Whether one's a morning lark or a night owl, my big message is respect your sleep cycle. It is what it is, right? One's not better than the other. Let's work with your body. So, whether you're a lark or an owl, I'm going to teach you how to read your body and to work with your body. So, one's not better than the other, but it strategies can be different. And the big strategy difference is instead of, society telling you you need 8 hours, or you should be in bed at this time, or wake up at this time, really to debunk those myths. And the big, big take home message is, what is your sleep cycle? What is your body telling you? What is your schedule, right? Because most of us need to wake up, work, make an income, and it's complicated. So I take in all of those considerations, with your body being the most important, and then working somebody through that schedule.
Mhm.
Um, Also, I think embedded in your question is, I help people time when to go to bed depending upon the signs that their bodies are giving them, right? So it's not some ascribed time of when to go to bed or when to wake up. What is your body telling you, right? So how can you recognize when you're tired versus when you're just sleepy, and getting really savvy with that? Only going to bed when you're sleepy and not just tired, and learning the nuances of that, because everybody has different flavors of that. So I really enjoy hearing people's stories, and really listening to their words of, and this is what I was feeling in my body. Because, a little bit of a side note, most of us aren't very good or have ever been taught about being in our bodies. We're up here. We live in a cerebral society. Think, think, think. Go, go, go. And when you ask somebody to get neck down in their own body, they're like, "What?" you know? And
Mhm.
honestly, for the most part, it's just that, like, I've never been asked to do that, kind of, what the hell do you mean? And then how the hell do you do that, right?
Yep.
Everybody's so capable. I'm no more capable than anybody else, but typically people don't talk about that. So that's why we don't need the gadgets. We don't need medicine. We need to slow down. Stop buying into the grind culture. What is your body telling you at this moment? Use those words, and bring in some education. And then, how do I work with that? How do I work with that to get really good optimized sleep? That's the exciting part.
What would you say would be the number one sleep sabotage that people run into, that you see that
Mm.
people run into, and then maybe a way to avoid that or work with
Okay.
that?
So
Yeah.
that's a good question. You're going to make me pick the top one, huh? Let's see. So, in hearing that, okay. Oh, there's so many. But maybe
Right?
my favorite one
Okay,
to
there you
work
go.
with, okay, and that comes through the door a lot,
Yep.
is so we're married to our phones, like it or
Yeah.
not. Most of us are, right? It's like having that
Mhm.
little computer in your hand. And as handy as that can be, and as many pros as that can have, it also has a lot of negatives, especially when it comes to sleep. So it's not uncommon at all for people to tell me they tuck in with their phone, right? So
Mhm.
they get comfy, they get in their jammies, they're tucked in, and they've got their phone right there. They're scrolling through social media, finishing up on those emails of the day. And again, not wrong or bad, just really not helpful for sleep. So that is a very, very common sleep saboteur that comes in the door a lot. And so getting people to break up with their phones at night, and ideally not use it as an alarm clock, or if
Mhm.
they do, set it face down on the end table, because you really want to set yourself up for success. You don't want that blue light. And for some of
Mhm.
us who are in front of a screen all day, or are just really exposed to a lot of blue light, we need this buffer zone. We need anywhere, it depends, everybody's so individual, but anywhere from 5 minutes to 30 minutes to buffer from day to day hustle, blue light, and all the things, to really winding down. And depending upon how wound up we are, cognitively and
Mhm.
somatically, that time frame will differ. Some of us can tune in and to a nice calm rest and digest nervous system, and our body gets it, and we can tune down pretty quick. Whereas others, it's more difficult, and there's no judgment. We just need to recognize that. And it takes them a little longer to get in touch with their neck down, and to stop, being just all in their thoughts. And so they need some relaxation exercises to really kind of bring down that nervous system. And that's kind of where the eclectic part comes. I don't buy into in clinical psychology or in coaching that one theory answers it all. So thank goodness we're all so different. So I love to pull from cognitive perspective, a behavioral perspective, a somatic perspective, and different things work for different folks. And I've got a lot of tools in the toolkit to try out and try on with regards to various aspects of what's going to work for you. Yeah. But that's super
amazing.
common. Going to bed with your phone and just not recognizing, honestly, how detrimental the blue light can be.
Well, and I like that you're able to tailor that to each person because sleep is such a personal
Yeah.
thing and we
Yes.
are incredibly different. Like even in the therapy room, one
Yes.
technique is not necessarily going to work have the same results on both people, both individuals.
Exactly.
So that's
Exactly.
wonderful.
Exactly. Yeah. Yeah. So there's a science, there's an evidence-based science to the interventions, and
Hmm.
you have to roll with the flow and be flexible. You'll see, like in my background and on my website, I've got this love affair with trees. And I was thinking
Hmm.
this morning before we got on, I mean, it's so symbolic for me. So to ebb and flow, when, for instance, when wind hits the tree, we have to be like that as humans. We don't
Hmm.
survive well and thrive well with rigidity. So I think it speaks to that, what you're saying. So yes, there's some science-backed interventions, and there's some nuances too, because some people may need just a little bit more time and some different eclectic techniques with regards to the relaxation component, right? Some
Hmm.
people may need a little bit more time with the cognitive restructuring. Some people may need a little bit more time behaviorally with the sleep hygiene aspect. So I never know what's going to walk in, but that's kind of part of the fun, you know?
Hmm.
Everybody's a little bit different. Thank goodness. It'd be very boring
Yeah.
if we weren't.
Well,
Yeah.
and it also is probably why somebody can try all these things that they know of and it just doesn't work. They just don't
Yes.
have the right, or maybe they have all the tools, but not in the right order. So it
Right.
really takes being able to have the right tools at the right time.
Yes. Yes.
And yeah.
Yeah.
Is there anything that you can think of that would be important to cover that maybe we haven't touched on already?
Yeah. Well, so the exciting thing is, I had mentioned a little bit earlier in the broadcast that I recently rebranded. I'm
Hmm.
big on access, so I'm excited because I just did this. So depending upon like as when people are listening to the podcast,
Hmm.
I'm providing 50% off, so half off of my whole coaching program for the first 10 people that sign up. So that's exciting.
Wow.
Um, Also, if they go to my website, w.rootstorest.com, there's a free ebook that's there for the taking. There's a lot
Mm.
of good information just on the website. I would say if you hear this podcast, know of somebody that can be served, feel yourself, have questions, book a free eval. I'm easy to talk to. I'm open. Book a free eval and let's talk. And I'll be very forthright of, yeah, I definitely feel like I can be of service, or I don't feel like I can be of best service to you because XYZ. So no pressure, free consultation, half off for the first 10 people that sign up, free ebook just for your liking and taking. So there's lots of goodies. There's lots of
And a
goodies on my website, as there should be.
And you had mentioned earlier 100% money back guarantee.
I'm excited about that. I'm
I mean,
very,
it
very
is
excited.
literally a win-win. I
That's
wish that
right.
had this had existed for so many of my clients.
Yes.
It would have
Yes.
been just a gem. Oh
Yeah.
my goodness.
Yeah. Yeah. And I agree. It is a win-win, and I think it speaks to the authenticity of myself with regards to she's not going to accept me into the program unless she's really confident because I
Mhm.
want you to succeed. So really kind of allowing your shoulders to come down, to take a breath and to know you're in good hands. So
Mhm.
I want it to feel like a win-win.
Yeah.
Yeah.
Wonderful. Wonderful. Well, maybe
Yeah.
just in closing, if you were going to leave the listeners with kind of a word from the wise and
Mm,
something possibly around sleep that they could take with them, what would be the
yeah.
one piece of advice that you would give?
All right. I've been thinking about this and it's important and I appreciate the question. So what comes to my heart and my
Hmm.
soul when I hear you say that is I want to be able to look women in the eye and to say, you're worth it. Whether you're coming from a place where you realize it or not, you absolutely deserve to be thriving. You absolutely deserve to be sleeping well and living your best life. That's huge for me. And to recognize sleep difficulty, although it's prevalent, 70 million Americans suffer from it. It just doesn't have to be like this.
Mm.
It doesn't have to be something that you accept. I don't want it to be something that you accept. So it kind of falls on that tagline of you're worth it. So if you're having sleep difficulty and you're even the slightest bit curious, bring your frustrated self to me. Let's have a call and let's have a conversation about if and how I can be of service to you because you deserve it. And I think we can lose sight of that as women sometimes. I think we can just so buy into the hustle culture that we forget it and that we fall asleep to that a little bit. And my mission is to gently, maybe not so gently, wake women up. Wake women up from this. You are absolutely deserving. You are absolutely worthy. And I'd love to be a part of that. It just
Ah,
doesn't have to be so tough.
I love
Yeah.
it. Love it.
Yeah.
Oh, you get me chills.
Thank
Well, thank
you.
you.
And thank you
Thank
for
you.
allowing me. Yeah. I just wanted to say thank you for allowing me an opportunity to connect with you, connect with your
Mhm.
listeners. It's important.
I think it's very important. It's foundational.
Yeah,
Well,
it
thank you so
is.
much for being here. And
Yeah.
yeah,